Well, naturally, we're very concerned, and our thoughts and prayers are with the families of all those who've lost loved ones in the last few days. And today's figures remind us how important it is to maintain the social distancing rules that the government have announced. It's absolutely critical that all of us stay at home, that we limit our trips away from home to just one a day for exercise. We limit the amount that we shop. If we do that, we can all play our part in helping the NHS. Well, we're doing everything we can at the moment to try to protect the NHS by limiting the spread of the virus. And, of course, there are different models, as you will know, produced by academics, but we follow the best scientific advice, and that advice is for all of us, if we possibly can, to maintain those social distancing rules, because if we do so, then we can flatten the curve, we can delay the onset of the peak, and then we can make sure that our NHS, which is becoming more resilient by the day, is better equipped to cope. Well, we want to do everything we can, both to reduce the spread of the disease, but also to support the NHS. And it's always the case that government stands ready, if necessary, to do what it takes in order to reduce the spread of infection. At the moment, all the evidence is that people are observing the rules. If you look at the number of people on public transport, that has fallen. If you look at footfall in supermarkets and other stores, that has fallen as well. All the evidence is that people, in a public-spirited, generous fashion, are displaying sort of solidarity with the NHS and with other frontline workers that we would want to see. But, of course, we keep things under review in order to ensure that if there are further steps, they can be implemented. But what we have sought to do is to make sure that we implement the right steps at the right time, following appropriate scientific advice. We can take further steps, but it's important that when we're thinking about something as serious as this, when we want to make sure that we have the right steps in place, that we're influencing people's behaviour in the right way, that we are keeping people safe, that we don't preempt discussion of what other steps may be required. But the Prime Minister, the whole government, we follow the advice that comes from our scientific advisors, from our medical advisors, and if there are appropriate steps that they recommend that we take, then we will take them. But it doesn't help those advisors, it doesn't help our preparations if we preempt them before we need to. Well, we have been increasing the number of tests, and I can confirm today that the number of tests being carried out has hit 10,000 now, and we want to increase that, 10,000 a day. We want to increase that to 25,000 a day. And just last week, just Friday, the Prime Minister authorised a new programme of testing, so working with research institutes and also with companies like Boots. We're now in a position to be able to test more. Boots have opened drive-in testing centres. We're increasing the number of people being tested all the time. And, of course, it's NHS and social care front-line workers who are first in line for those new tests. We want to make sure that we can test, and test again, because, of course, if we are able to test, not only do we have a better picture of the spread of infection, it's also the case that people who at the moment are self-isolating because members of their family have symptoms, if we can test and we know that they are negative, then we can get them to join the front line. And, of course, it also critically protects the health of people at the front line who are working so incredibly hard at the moment and whom it is all our duty to support. Well, we have available to the NHS now just over 8,000 ventilators. That's because we've repurposed some of the intensive care capacity that we have in the NHS. It's also the case that Simon Stevens, the Chief Executive of the NHS, has done a deal with the private sector in order to increase ventilator capacity available to the NHS, and we are going to get another 8,000 or so ventilators, including some which have been sourced from abroad, which are coming here from other countries. And, of course, we're increasing our capacity to manufacture ventilators in the UK. As you'll be aware, we've done a deal with Dyson, which means that provided all the appropriate tests are passed, we can have an additional 10,000 ventilators from that source alone. And there are other companies, from McLaren to Rolls-Royce and others, who are changing the way in which they manufacture in order to join in the national effort to increase the ventilator capacity available. When it comes to beds, Simon Stevens, again the Chief Executive of the NHS, outlined on Friday that as a result of cancelling the non-essential work in the NHS, and also as a result of the decision to open a new hospital in East London, NHS Nightingale, we've managed to release the equivalent of 50 hospitals worth of new beds to deal with COVID-19 patients. Well, the Prime Minister is in charge. On Friday morning, he chaired the meeting that brings all the effort of government together with ministers, officials, scientists and doctors. And he did so from his study in Downing Street using modern technology. We had a video conference and the Prime Minister was in charge. He was the person who was driving forward our efforts on testing, making sure that we increase the number of tests available. He was the person who was interrogating the forward supply of ventilators in order to make sure that we had the capacity required. He was the person who was overseeing our support for frontline workers in other areas, in food production and so on, in order to make sure that the life of the nation can continue. So he is very firmly in charge, and later this afternoon, the Prime Minister will also be hosting another meeting by video conference with the relevant ministers and officials. The designated deputy to the Prime Minister is the First Secretary of State, Dominic Raab.